Hello, my name is Matt Lukowski, and I am a practicing certified wound and ostomy nurse at a relatively large acute care referral hospital in central New York. Thank you for watching this presentation about education on a chronic illness. Today, I would like to talk with you about lymphedema. I'm interested in this condition because I receive several consults a month for assistance with lymphedema patients, and one of my colleagues also suffers from lymphedema. Before we get started discussing lymphedema, though, I would like to remind everyone that not all information on the internet is created equally. In order to make sure you are getting accurate and reliable information when looking up a medical topic online, you should make sure that the site that is being viewed is reliable and has undergone some sort of vetting process. In general, most government-sponsored sites or those with a .gov or .gov web address should be reliable. When viewing private sites, however, be sure that they have been reviewed and accredited by at least one of the many organizations devoted to making sure the information provided is transparent and reliable, such as Health on the Net or GuideStar. An easy way to do this is to go to the Health on the Net or HON website and perform a search. On the screen you see I've done just that. I've typed lymphedema here in the search bar, and it has given me several options for certified, credible websites that I can get information about lymphedema. In doing my research on lymphedema, I found that unlike many other chronic conditions such as diabetes or heart disease, there is no one dominant website that is all-inclusive and easy to navigate. However, the website that I found to be best option for use with patient education is the National Cancer Institute Physician Data Query, or PDQ, put out by the National Institute of Health. It has a Turnitin SEER assessment score of 3.8, but this site is not perfect. For instance, on this site, lymphedema is categorized as a side effect of cancer treatment, and this could be difficult for patients, make it difficult for patients to find without some direction. And you can see that here. Also, the site is a bit bland. It only has one graphic and relies heavily on bullet lists of information that can make it cumbersome to navigate. And you can see that here. The reason I chose this site, though, is while bland and a little awkward to sift through the material, it has a majority of the information needed for a patient to understand what lymphedema is, the types of lymphedema, how it occurs physiologically, the signs and symptoms, risk factors, and the various treatment options available. Also, there are many hyperlinks scattered throughout the text that help to further explain medical terms and physiology that may be confusing to patients. And here we can see one of the hyperlinks, and if I click on it, it brings up a fairly concise definition with a little graphic here for a patient. One area of the site that I feel is particularly useful is the section titled "The Lymph System is a network of lymph vessels, tissues, and organs that carry lymph throughout the body." This segment provides a nice explanation of the anatomy and physiology of the lymph system and has a color diagram representation of the lymph system that is well labeled. And here we can see that section, and here's the diagram. And we click on it in large, and it brings a pop-up that's well labeled and gives a nice reference for the patient. In my role as a wound and ostomy nurse at a relatively large referral acute care hospital, I get many consults for lymphedema care. This website is useful because it provides me a tool to help patients to better understand their condition and treatment options available. And as we scroll through the site here, we can see that it talks about why lymphedema occurs and the way it progresses throughout the body in certain areas, the two types of lymphedema, possible signs and symptoms of lymphedema, cancer and its treatment that are risk factors for lymphedema, tests that may be used to diagnose lymphedema, stages, key points on managing lymphedema, some studies, links to studies of lymphedema, some key points on treatment of lymphedema, It also has a few useful links to assist patients in finding practitioners and services to aid in their care. The first link is a link to the Lymphology Association of America, which can be found right here. When clicking on this link, it brings up the LANA website, and by putting in a little information and your location, you can find a therapist near you. The second link is the clinical trials link. Which can be found right here. This link allows patients to look up clinical trials that they may be available for lymphedema treatment. And so that brings up this page, and here you can see there are a couple of trials that are ongoing that people may qualify for that may assist with their lymphedema care. One final link that may be useful to practitioners or organizations providing care for patients with lymphedema is the Syndication link, which may be found here. By clicking on that link, it takes you to this page, which gives you step-by-step instructions for allowing a link to be placed on a practitioner's or an organization's web page so that patients may more easily find this National Cancer Institute page on lymphedema. One link that is not present that I would have liked to have seen on this site is a link somewhere on here that is directing patients to various support groups for lymphedema support and care. This concludes my presentation on the National Cancer Institute's webpage about lymphedema and its care. Thank you.